Good evening, everyone. We're just waiting a few more moments for all of our participants and attendees to join. We'll be getting started in just a few moments. I think we can get started. Good evening again and welcome. Welcome to What to Know to Stay Covered through New Jersey Family Care Renewals and other public health emergency changes. I am Laura Waddell, the Healthcare Program Director at New Jersey Citizen Action, and we are so happy you're joining us tonight, and we hope to provide you with some good information about all of the recent changes going on in healthcare and coverage. And we want to hear from you throughout the hour or so that we're going to be on here together tonight. But before I go any further, I have to give you some housekeeping items to note. We are offering tonight's session in English with an option of dialing into the Spanish translation. Those who are on Zoom can access the translation by clicking the interpretation icon at the bottom of your Zoom toolbar. It kind of looks like a globe, and then select Spanish as your language that you would like to hear. If you would like to only hear Spanish, you can click mute original audio. All right. And for those joining us on Facebook who would like to dial into the Spanish translation, you will need to join us here on Zoom. So we're putting the link to register to receive the Zoom information in the chat now, and we'll continue to do so throughout the information session for those joining us later. All right, next, I told you that we want to engage with you throughout this event, and we mean that. If you haven't already given us your questions when you registered, please feel free to do that at any time tonight by putting your questions in the chat. We will have a question and answer section towards the second half of our program tonight. And I would like to now take a little time to thank the co-sponsors of this event, the Camden Coalition, the Greater Newark Healthcare Coalition, the Health Coalition of Passaic County, and the Trenton Health Team. We are all really excited to bring this information session to you. For those of you who are new to Citizen Action, we are a statewide advocacy and empowerment organization that advances social, racial, and economic justice for all, while also meeting the pressing needs of low and moderate income New Jerseyans through education and direct services. In a moment, we're going to speak a bit about Medicaid redeterminations and the ending of the federal public health emergency and the significance of April 1st and May 11th of this year. Then we'll hear from our ACA Enrollment Director, Gabrielle Escribano, who will dive deeper into the process of redeterminations and enrollment, and then she'll be sticking around with us to answer some questions later as well. But first, I'd like to take the next minute to hear from all of you through a quick poll. Tell us, great, thanks, Adam. Tell us, how much information have you heard already or received about the ending of the public health emergency or Medicaid redeterminations? Take a few moments. Give you a few more moments to finish your poll. All righty, let's see. We can close the poll and see what it tells us. Okay. Not much. Looks like not much and some, but there's also quite a bit of none too. So you are in the right place. And it does look like we have some mixed familiarity with the changes in healthcare and coverage that are happening. So just to kind of get everyone on the same page before Gabrielle's presentation, let me give you all kind of a broad overview of what's happening. So beginning April 1st, New Jersey FamilyCare restarted its process of renewing the accounts of enrollees to determine their eligibility to remain enrolled in the program. This process is called eligibility renewal and redetermination. It's a process that traditionally happens at least once a year, but was suspended during the pandemic with the declaration of the federal public health emergency. So for the past 3 years, these Medicaid redeterminations have been put on hold. Well, now that the federal public health emergency declaration is ending, New Jersey FamilyCare has restarted the process of redeterminations back on April 1st. You know, there are over 2.2 million people enrolled in New Jersey FamilyCare, and all of those accounts will be reviewed over the next 12 months. And we've been told by the Department of Human Services, which administers New Jersey FamilyCare and Medicaid, that they have not assigned specific eligibility groups to particular months or dedicated particular groups to each month to review, but instead they're dividing all of the population and eligibility groups up over the next 12 months. And in a moment, Gabrielle will talk through in more detail what to look out for, what the redetermination process is like, but you do want to make sure your contact information and address is current with New Jersey FamilyCare, so you can prevent a delay in receiving your eligibility documents. And you need to complete and return them on time. This is crucial and critical to preventing unnecessary loss of coverage. And additionally, we want to talk a bit about the ending of the federal public health emergency happening on May 11th and what it means for all of us, regardless of whether or not you have insurance and regardless of what insurance that you do have. You know, the reason why we want to pay attention to this is because it has a lot to do with the availability, the access, and cost of COVID-19 vaccines, tests, and treatments. But in general, COVID vaccines, testing, and treatments will continue to be offered at no cost to us. But the recommendation is that for those with insurance, you should always check with your insurance company and plan to confirm coverage and any out-of-pocket costs if applicable. And for those without insurance, this will continue to be offered to you at no cost. So now that we're all kind of starting from the same place, let's hear a little bit more detail about all of this from Gabrielle. Gabrielle?
Thank you so much for introducing me, Laura. Let's get this started. All right, so the state is doing a wonderful job at making sure that we're all notified about this Medicaid redetermination process. So what I wanted to start out with is its outreach, right? So what by now, most of us should have received some sort of renewal packet in the mail, renewal envelope, all right? If you haven't, though, there is a possible chance that you might receive one of these postcards. Don't panic if you receive this postcard. That simply just means that your renewal packet is right around the corner. All right. So make sure you keep an eye out for it. Make sure you're checking your mail all the time on a consistent basis. All right. If you haven't received it yet and then you still don't receive a postcard, that's now another reason why you may want to call New Jersey Family Care and ask them to please send you a renewal packet. Okay. Now, these postcards are going to come from your HMO, not New Jersey Family Care, okay? So those HMOs could include Aetna, AmeriGroup, Horizon, WellCare, and United Healthcare. In addition to postcards, okay, they're going to be sending out text messages. They're giving out phone calls, emails, all right? An example of what that text message may look like is, by now you should have received your New Jersey Family Care renewal mail. Please open it and follow the instructions right away. If you receive a text message like this and you haven't had your renewal packet in the mail, that might be your time to go, wait a minute, let me call New Jersey Family Care. And they provide the phone number right there for you. So make sure that you're advocating for yourself. I just got this text message. I haven't gotten a renewal packet, but the text messages say that I got it. Let me call New Jersey Family Care and let me find out what's happening, right? Now, when it comes to the phone and the email messages, they're basically the same theme. The theme that you're constantly going to see is going to be on the lookout for your New Jersey Family Care renewal packet. Whether that's a packet, an envelope, a mail, just make sure that you have filled out a renewal application for New Jersey Family Care, all right? Now, you might be asking yourself, okay, what exactly am I looking for the mail and how do I know that this is my renewal packet? When I received this letter, the first thing that I noticed right away, oh, not able to, here we are. Sorry about that, guys. The first thing I was able to see is renewal enclosed. That immediately let me know this is my New Jersey Family Care renewal application. All right. Important information regarding New Jersey Family Care benefits. Very important, okay? Our health insurance can cost thousands and thousands of dollars. With Medicaid helping us out, right? And this whole process that we have, we want to make sure that we continue having coverage. And in order for us to continue having coverage, we need to fill out this renewal packet. Okay? So please make sure you open it right away and follow the instructions inside. The instructions are typically on a cover letter. So on your New Jersey Family Care renewal application, there's going to be a cover letter right on top. That cover letter typically has the date they sent it out, your policy number or your case number. It has your full name, your address, okay? And then it gives you a full description of what they expect from you. They expect you to submit your renewal application within 30 days. They expect you to make sure you're filling out the application accurately. Maybe they're asking for some other information that they have not yet received from you. Whatever the case might be, you really want to make sure you're reading this cover letter. That's the first thing you read. That's the first thing where you go, okay, how do I understand what I have to do, okay? If for any reason you do not understand this cover letter, that's what New Jersey Citizen Action is here for, okay? We have assisters ready and lined up waiting to assist you, okay? We can go through these letters, and if you want to call New Jersey Family Care yourself, you can absolutely do that once we explain to you what the letter means. Or we can absolutely go through the letter with you, explain to you what exactly you need to do, help you go through the entire renewal application as well. But if you want to do it yourself, just remember, make sure that you're reading this cover letter thoroughly. what you're going to see on every single one of these documents is a policy number. See all of this? Those are policy numbers, okay? In addition, the next thing that I always look for is how many pages is this application? I see page 2 out of 7. Therefore, I'm going to make sure that I'm filling out at least 7 documents, okay? They might be front and back, so you want to make sure that you're checking that out. It might need a simple signature from you and a date. Don't delay your application by not providing every single documentation that they asked for, okay? Says it right here, renewal application. Now, I do have this example up. I don't want you to think that every case is exactly the same and every renewal packet looks like this. We are all different individuals. And remember, New Jersey FamilyCare is based off of our household size and our household income. And you'll see that these barcodes are very useful for New Jersey FamilyCare, okay? And you'll have all your information that New Jersey FamilyCare has about you all on your left side. And on your right side is where they're asking you to please update those changes. So that's what you want to make sure you're doing. This side, they're saying, hey, this is your home address. This is your mailing address. If that's incorrect, I'm going to then go over here and I'm going to write in the correct home address and the correct home mailing address, and so on, and so on, and so on. Okay? Remember, if you do need help with this, do not panic. There are many assisters available to assist you, starting with New Jersey Citizen Action, okay? If we're not available to assist you as well, New Jersey FamilyCare customer service can also assist you too. So do not panic, right? Now we're talking a lot about, outreach and how New Jersey FamilyCare is reaching out to us because of these renewal packets. So we wanted to make sure that you're aware of certain scams, right? Yes, New Jersey FamilyCare is going to send you these envelopes for you to fill out. However, they're not going to ask you for your, they're not going to give you a call for your bank account information, right? They're going to give you a call to say, hey, fill out your renewal packet. What's your HMO? If they do call you. But they will never, ever, 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 ever ask for money in a text message. They're never going to ask for money over the phone. They are never going to ask you for your personal or bank account information over the phone as well. Why? Because we are all filling out online applications. If it's not an online application, then it is a paper application. All right, we're not filling applications just right over the phone with New Jersey FamilyCare. All right? So lastly, you want to make sure too, it is a scam, that you know it's a scam if they are making threats about legal actions or demanding that you are secret about their conversation. All right, that all gives you just scam vibes, all red flags. Okay, so make sure you pay attention to who is calling you, what questions they're asking, and when in doubt, if you feel that something's not right, most likely it isn't. So this is what you can do. Thank you so much, Laura, for giving me a call. Can I have your name and your phone number to give you a call back? What's your title? Case manager, New Jersey FamilyCare. Her name's Laura Waddell, and here's the phone number where you can reach me back. I'm simply going to call that number back to see if it's an actual phone, phone number to New Jersey FamilyCare. And if that's still, making you feel uneasy, then I would actually call the 1-800 number for New Jersey FamilyCare directly and say, hey, someone is trying to reach out to me to verify some information. Can I give you the information? It will never hurt, okay? But what you don't want to do is willingly give unnecessary information out to people who they just don't need it, okay? Again, we're here to help you. So if you do come across some sort of scam or you don't know how to approach it, give us a call and we can definitely tell you what your next moves should be. So now I filled out my renewal packet. Yay, yay, yay. And I got the information that now my son's going to be taking off of this plan, right? I'm still not going to panic. Why am I not going to panic? Because not only are they going to give me a termination letter, is that inside that termination letter, they're going to give me my access code, or they're going to give me information on Get Covered New Jersey. Get Covered New Jersey is the marketplace of the state of New Jersey, okay? Also known as Obamacare. Now, why does this make me happy? Because you're not left with nothing, right? You want to make sure when you get that letter, you keep that letter, but you're also reading the information within the packet, because there's a lot of information in there. And it may help you with what's your next step and what's your next move to make sure you don't have a gap in your coverage, or your family doesn't have a gap in their coverage, okay? Now, the letter will also let you know if your renewal was submitted or not, okay? Does this make a big difference if your renewal was submitted or not? It does. And we'll talk about that later on, okay? Or we'll talk about that right now, sorry. All right, so these are two possible paths. I've just been terminated from New Jersey FamilyCare, and they let me know that I can go to Get Covered New Jersey. Remember, I talked about that access code, right? So this is our first scenario here. If the consumer, me, I was found ineligible for the New Jersey FamilyCare program, I wait for those documents, right? And in those documents, I'm going to receive an access code, because there is now an automatic account that was transferred to Get Covered New Jersey. Do I want that automatic account to be created? Absolutely. That makes the process 10 times easier. I will not have to submit everything all over again. They're going to transfer your name, your address, you know, what happened with your New Jersey FamilyCare eligibility. They're going to transfer that all to Get Covered. Now the appointment may be about 20 minutes, right? So this is a great scenario here. But let's say for some reason, I was just being unresponsive. I got my renewal packet. And when I got my renewal packet, I put it in the hallway, a desk that I put in the hallway. And I kept leaving it there, and I kept leaving there, and we've passed the 30 days now. I will then be receiving a letter, okay? And that letter is going to let me know I've been terminated because I am non-responsive, okay? They're still going to give you the info for Get Covered New Jersey, so that's the good thing, right? The difference is that if you're terminated to not being responsive, is that then you're going to have to create an account from scratch. Is that okay? Absolutely. Create your account from scratch. But to avoid these gaps, to avoid these delays, to avoid, again, now you have to get on the phone with another person and try to figure out this account. You really want to submit your renewal as soon as possible. I'm telling you, getting your account transferred from New Jersey FamilyCare to Get Covered New Jersey is going to be a breeze. This process is already frustrating, so you want to make sure you're making this as easy as possible for yourself, okay? Now, a couple of folks might be saying, oh, well, what's the point of waiting? I can just go on Get Covered New Jersey today and see if I'm eligible. You don't want to do that, okay? You want to avoid duplicate coverage and potential tax implications. Consumers should apply through Get Covered New Jersey after that they receive notification from New Jersey FamilyCare that they are no longer eligible for that coverage, okay? Trust me, you don't want to make a duplicate account in there. It will delay your process. It's already frustrating, so let's make sure that we do this by the book, and that is get your renewal packet, okay? Fill out that renewal packet, send your renewal packet, and then you will get a letter with your final determination, and depending on what that letter says, you will have several pathways on how you can still have affordable health insurance. Now, let's say you just don't agree with what the state is telling you. That's okay, all right? There are things that we can do, and it's called an appeal process. We have the right to a fair hearing. Now, this is where we'll urge you to please get an assister to assist you in this. Please get some sort of representative to help you in an appeal, okay? Assisters are your accountability partners. We're the ones that are on top of you about the documentations you need to submit. We're the ones that contact New Jersey FamilyCare with you and ask all the right questions, and we will follow up and continue to be on top of you and New Jersey FamilyCare regarding the appeal. Okay, the rights are always explained within all that mail that you do receive. So again, you might receive a termination packet, and in that packet, you will receive an appeal document. You want to appeal. Again, urge you, get someone to help you with this. But if you want to do it yourself, fill out that letter, fax it back, mail it back, and worst case scenario, you can always call New Jersey FamilyCare as well. Now, let's say you lost your eligibility because you did not provide all the information that was needed. Well, the good news is that you still have 90 days within that time period to have your renewal application reconsidered. So you have 30 days to fill out your renewal packet. However, once they do terminate you, and I forgot that my renewal packet was there, I do have 90 days to try to fix it, okay? To try to go, okay, let me try to get back on this health insurance, all right? That just because your application is being reconsidered though, please don't think that you will get approved, all right? It's still a redetermination process that's happening here, okay? And lastly, like I keep reminding you all, if you are ineligible for New Jersey FamilyCare due to your income level, you can apply for coverage through Get Covered New Jersey. Now we're probably asking, what is Get Covered New Jersey? Talk a little bit about that. Remember, it's New Jersey's official health insurance marketplace. It's also known as Obamacare, okay? I love this system. Why do I love it? It's a wraparound service, okay? You can go right into Get Covered New Jersey. You can find out what financial assistance you can get, what's the estimates. You can find out if you qualify for New Jersey FamilyCare, and they have these medical and dental health insurance providers, which they're great providers. And what you want to do is, well, what it does is that it provides you about 3 pages of different health insurance plans for you. So for medical and for dental, which are separate from each other, you'll see that there are 3 pages worth of different health insurance plans that are beneficial to you and your family. You get to choose out of those 3 pages which one of those plans best fit you and your family's needs. And it's the same thing with the dental. All right. Going back to financial subsidies, no one is going to spend more than 8.5% of their income on health insurance premiums. And this isn't any income. You might as well give it a shot, all right? I hear a lot of times people tell me, I don't think I qualify. I think it's too expensive. I think the sky is purple. Guys, don't stop yourself from applying for affordable health insurance. The worst thing that can happen is you choose nothing on there, and then you might have, a tax penalty at the end of the year. But let's say you go on there, you take a look, you might be actually surprised of how much financial assistance you receive. You might be surprised on the type of health insurance plans that are out there that actually help you. And actually the quality of care as well may be surprising to you as well. So give it a shot, all right? Anyone who applied before 2021, by the way, they should reapply, because this is the time the financial subsidies are have increased. And I'm telling you, 9 out of 10 New Jersey residents will qualify for some sort of financial assistance. All right. Get Covered New Jersey has Horizon, AmeriHealth, Oscar, Aetna, WellCare, Garden, and a lot more as well. If you choose to upload your own documents, you want to create your own account, that's absolutely fine. I have the website here. It is a user-friendly system, so that's really good news. When might you want an assistant? If for some reason those questions, you're just not aware of what exactly it is, just remember we are certified, so we can help you. We can go through the process fast, and we're your accountability partners. Sorry. So certified application assisters. I keep mentioning that New Jersey Citizen Action has these assisters. Well, not only does New Jersey Citizen Action have these assisters, there are 17 other organizations that have application assisters as well. Okay, if you need to find assistance to help you with this process, you can always go on the Get Covered New Jersey website, and you can look for find local assistance around me, okay? But why should you choose a New Jersey Citizen Action certified application assistant? Simple. We help you navigate through the Get Covered New Jersey marketplace and New Jersey FamilyCare application process, okay? We then assist you after enrollment as well to make sure everything's great until you have your health insurance, okay? We can upload those documents for you. We're properly trained and we're certified. We're not guessing here. We know these things, okay? We have unbiased assistance. I'm not going to push Horizon on you. I'm not going to push any specific provider on you. I'm simply going to ask you, what is your budget? What are your needs? And then we're going to provide to you at least 3 to 4 different health insurance plans that fits your needs, okay? Lastly, we're free of charge, completely free, okay? Application assisters are free of charge, okay? So before you decide to pay someone to help you navigate through health insurance, please take a moment, take a step back, remember about this webinar, and please reach out to us. What you don't want to do is miss all of these deadlines. You have 30 days to renew from the day that you received, from the date on the cover letter of your New Jersey renewal application. All right, so if the date says April 19th, it's due, or April 19th, I see it on there, I have 30 days from that date. The good thing is we don't have to guess. Right on that cover letter, it will tell you when the application is due. So you don't have to guess when is it 30 days. Just look at the letter, okay? Remember, if you did lose eligibility because you did not provide all the information that was needed, you can still reapply, and your application will be reconsidered at the renewal, okay? From the moment that you are terminated, that termination date, you then have 60 days to apply for Get Covered New Jersey. Right? You have 60 days to create that account and apply. Get Covered New Jersey provides then an additional 120 days for you to enroll into a health plan, okay? Remember, 60 days to apply. Once I've applied, I can sit there and wait and look at my health plans and see which ones fits my needs. I have 120 days to do that. I would suggest, though, to delay any kind of gaps, that you enroll into a health plan within the 60 days, all right? What everyone should remember here is that make sure Medicaid has your correct mailing address. If you need assistance, we're here to help you. But if you are able to, I urge you to please contact New Jersey FamilyCare. Let them know, I haven't received my renewal packet, or this is my new contact information. If you haven't received mail from New Jersey FamilyCare in over a year, then you're the person who absolutely should be calling New Jersey FamilyCare, okay? And lastly, we wanted to make sure that we provided information if for some reason you do not qualify for New Jersey FamilyCare or get covered New Jersey. Where you want to go is to your nearest federally qualified health center, FQHC, all right? They deliver high quality health care to all people regardless of their ability to pay. All right, you don't need health insurance. So what I always tell people is what you don't want to do is you never want to just walk into a clinic and just assume something. Give them a call. Ask the questions. All right, how much do you think this is going to cost me? Is it realistic? Is this even real? Can I really come in here without health insurance? Okay, ask all the questions that you need. Does this health center have a dental care? Does this have women's health? Okay, every qualified health center are different. All right, they serve the uninsured as well as patients with Medicaid, New Jersey FamilyCare, Medicare, and private insurance. Okay, so if you do not have insurance, fees are going to be charged based on your income level using a sliding fee scale. Okay. No one is ever turned away simply because you don't have funds. And let's say you're in desperate need, you know, speak to them, let them know, is there any way that you're able to bill me for the services today? And again, you can ask all those questions by calling them near you. Here you'll see a long list of how you can contact us, okay? For free enrollment assistance, we do speak English and Spanish here. You have our call and email information on the screen. If anyone's interested in enrollment workshops or events, whether that's being virtual or in person, maybe your church would benefit from having some assisters there to, you know, educate folks on the Medicaid redetermination process, just reach out. Hey, you never know, and I will absolutely do my best to assist you. All right, Laura.
Thanks so much for all of that, Gabrielle. You know, it is really good to know that should an individual or family be found no longer eligible for New Jersey FamilyCare, there are ACA market plans available, and 9 out of 10 people who enroll qualify for financial assistance. It's also worth noting that, as Gabrielle mentioned, there are 17 navigator organizations located throughout the state who offer free enrollment assistance, of course, of which New Jersey Citizen Action is one. So let's hear again from our audience with our next poll. Would you like to be connected to health insurance assistance? Yes or no, select one of those choices. And as you're doing that, or after you do that, those who select yes will be contacted by one of New Jersey Citizen Action's enrollment assisters. So we'll give you a few more moments before we close the poll. Okay. Thanks so much. I think we can close the poll. Great. Alrighty. Now let's see here. Let's move on to our question and answer portion of this program. Thank you to all of those who submitted questions ahead of time. And I also see many have been putting questions in the chat, both here and on Zoom and on Facebook. So if there are any questions we are not able to get to tonight, we'll be sure to send the responses to everyone in the follow-up email you'll receive tomorrow. So let's see our first question here. Actually, one of the questions that I have seen is if you will be receiving a copy of the slides and the information and the recording, and the answer is yes. So tomorrow, all of the folks who registered and attended will receive a link to the recording of this program, as well as a copy of all of the slides. So you will, so the answer is yes there. And I believe I also saw a question in regards to whether or not the redetermination and eligibility materials are offered in Spanish, and the answer is yes. The packet is mailed out in both English and Spanish. So let's see, our first question for Gabrielle here. How will beneficiaries know when to expect renewals in the mail? Can they call somewhere and find out when this will occur?
Absolutely. So honestly, by now, most of us should have received renewal packets. However, if you do feel that you haven't received the renewal packet and you don't want to wait till the end of this month, you can call the New Jersey FamilyCare customer service line. And they do have interpretations for about 150 different languages, where they can assist you with whether or not they did send you out a renewal packet, and resending one out for you.
And I think too, as you mentioned, those postcards and the text messages and calls are also reminders that if a renewal packet went out to you and you hadn't received it, and you did receive one of those, that's kind of a reminder to give New Jersey FamilyCare a call and let them know that you didn't get your packet. Is that correct, Gabrielle?
Absolutely, absolutely. I would say if it's already hitting May 11th and you haven't gotten anything, definitely give them a call and check on that.
Mm-hmm. And then also remember that they are dividing the redeterminations in 12 months. So 1/12 of the population of people who are currently enrolled in New Jersey FamilyCare will be receiving their packets each month. So, 1/12 in April, another 12 in May, and so forth and so on. This question asks if this person was approved for renewal in 2023, do they need to reapply in May to continue benefits?
That's a great question. If you have documentation stating that you have health insurance for the remainder of the year, then you do not need to reapply for New Jersey FamilyCare. All right. On that documentation where they sent you the approval, it should have stated on there for how long the insurance is for. And if it does not, because it's in 2023, you can expect another renewal packet in 2024. That was a really good question.
And I know you did touch on this, Gabrielle, but it's worth mentioning again. This person is asking if there is a loss in Medicaid coverage, will they be given a grace period to get another health plan?
The short answer to that is yes. So you have 60 days to apply for affordable health insurance through the marketplace. If for some reason you weren't able to apply within those 60 days for the marketplace, I would suggest that you reapply to New Jersey FamilyCare within those 90 days period. If it's past the 90 days and it's past the 60 days, then we're looking at contacting customer service for you and finding out how else can we get this extended. Again, you want to do this as soon as possible.
Great. Are documents still expected to be submitted if they are uploaded online?
If you receive documentation from New Jersey FamilyCare asking for a document and you felt that you already uploaded it, you have two options. You can contact customer service to find out, hey, do you have this document since I already sent this? Or you can refax the document. But if they do send you a document saying that you owe that, you need to make sure that either they received it or you need to resend it.
Thank you. For those people who've missed the 30-day renewal window and who have missed the 90-day reapplication window, when would be the next available time for reapplication? Would it be at a regular annual enrollment?
It would be at a regular annual enrollment. The best time to apply then would be November 1st for the open enrollment period, which is between November 1st and January 31st, so that they can have coverage starting January 1st.
Great.
Just one more note, remember that with New Jersey FamilyCare, you can apply all year long. So that is something to remember. If you do truly believe that you are eligible for New Jersey FamilyCare, you can reapply.
Thank you for that. For those individuals and families who were on Medicaid prior to the pandemic, will their status change any?
It would all depend on the household income and the household size. So I know that they had prior health insurance, but they just need to remember that everyone on Medicaid is going to be redetermined, and depending on our income size and our income household, on our income is how they're going to determine whether or not we're still eligible.
Let's see. If you lose your New Jersey FamilyCare coverage, could you say again how long they'll allow you to stay on until you find new coverage?
So the question is, if you've been terminated from New Jersey FamilyCare, will New Jersey FamilyCare keep you until you find coverage?
I guess they're wanting to know when will the Medicaid coverage end after they receive the termination letter.
All right, so you really want to pay attention to these letters. They're very informative, okay? On the letter, it will let you know when is the last day of your health insurance being active. All right, it will let you know how many days you have to apply for the marketplace. So again, I really do urge you that as soon as you get this document, you need to be able to comprehend the document. If you don't, reach out to someone so that we can help you decipher what the document is telling you.
This is kind of a general Medicaid question. What if your job offers coverage that you can't afford? Could they apply for a Medicaid plan?
So it does depend on your income and your household size, but majority of the times you will not be eligible for New Jersey FamilyCare. What you're looking to apply for is Get Covered New Jersey. With Get Covered New Jersey, if they find that your employer's health insurance is not affordable or not essential benefits, then there's a possibility that you may qualify for a more affordable essential health benefit plan. Now, this will have to be during the open enrollment season, though, because you do currently have health insurance. So you want to wait until that November 1st to January 31st portion there, and then you can reapply. Again, get an assistant to help you. So like that, we're able to navigate those special questions for you, make sure that you're providing accurate and current information.
Thanks. This one is asking, while your application is being redetermined, can you and your family still go to your doctor's visits, or should you hold off until a determination has been made?
Absolutely. Go to the doctors. We have health insurance. We got to use it. Especially take advantage now, right? So yeah, so just because your insurance plan is being redetermined doesn't mean that you're terminated. Until you get an actual document that says you will no longer have health insurance starting June 1st or May 1st or whatever the case might be, you still have active health insurance. When in doubt, can always call New Jersey FamilyCare and check on the status of your application, and they'll tell you active, pending, processing, so that you can get a better understanding of where you are with your application.
Great. This is just for a little clarification about if they receive a termination letter. So if they get that letter, what type of information will also be in that letter to connect that person to get covered NJ? Is it like a code or something? What else, what other information would they receive in their termination letter to connect them to other coverage?
So as of right now, it would just be get covered. I don't want to lie in saying that I've seen anything just yet because we haven't had terminations yet. So the documentation is simply going to say, you know, this is where you can go for affordable health insurance. We either created an account for you and here is your access code, or it's going to say you can create your own account. All right. Because remember, if you actually fill out the renewal application and you get denied, then an automatic account is being created for you with Get Covered New Jersey. It's those folks who didn't fill out the renewal packet, you know, and are struggling with it that are going to have to then create an account on their own, and there is no automatic account that was created for them.
Gotcha. Here's a general, Medicaid question. Could you share information on how all of this impacts folks from the refugee community that depend on Medicaid healthcare?
Sure. I mean, again, they're doing a redetermination, but they're not going to just push you out of health insurance. That's not what's going to happen here. Okay. I want you guys to remember that they are giving you options. So I know that Get Covered New Jersey is scary because we don't know what to expect from it. But, you know, I go on the website, go to the estimation tool there, and you'll be able to see what you may qualify for. You might qualify for financial subsidies. It may say that you still qualify for New Jersey FamilyCare. There's nothing for you to worry about. But again, you know, we can't go so negative so quickly. You want to make sure that you're reading your documentation, you're filling that out. You know, if this refugee is making, you know, that money, then that's okay too, because we're going to help them out with the marketplace. And if they're not, that's okay too, because New Jersey FamilyCare will see that they are in need of the services.
Thanks. How can a new 60-year-old immigrant get coverage if he is not in the country for 5 years but has low income?
That's a really good question too. Unfortunately, the 60-year-old will not be eligible for New Jersey FamilyCare. The eligibility requirements are that you must live in New Jersey, You must be a citizen or lawfully present for 5 years or more. Okay. So, what we would be able to do, and I'm so happy you're on this webinar, is we can assist that client with the marketplace. Because with the marketplace, you do not have to be lawfully present for 5 years or more. You can be lawfully present for less, and we can assist you with that marketplace application. What I will let you know is that depending on, what the income is, will depend on how much subsidies they receive and how much his health insurance will cost.
And this question is in regards to undocumented individuals. Can they qualify for Medicaid?
Great question as well. As of January 1st, 2023, undocumented children, it doesn't even matter what their immigration status is, that 5-year band is completely thrown out the window. New Jersey FamilyCare is going to cover all of New Jersey resident children, okay? And that's under the age of 19. However, for adults, there is no assistance with Get Covered New Jersey or New Jersey FamilyCare if you are undocumented. If you are undocumented, you are an adult, I urge you to please go to a federally qualified health center so that then you can be seen and they will charge you based off a sliding fee schedule.
Thank you. And that kind of answers some of these next couple of questions that talk about, what you do when you're denied both. You would recommend that they reach out to their county FQHC, federally qualified health center.
Before they do that, I would urge them to please give us a call. Sometimes it's simply you didn't press something on your application. Okay, sometimes it was just a mistake that you made. And remember, us as sisters, we see these applications all day, maybe 60 times a day, where we're able to notice, okay, you said you weren't going to file taxes and that's why you weren't approved, or, something that small, you pressing on a different button can change the outcome of your results. So if you find yourself not eligible for both, and again, these red flags are going on and you're like, how is this possible? Give New Jersey Citizen Action a call so that we can go into your account and find out if everything's filled out accurately, if we did an appeal, and how much more can we help you? And of course, if we still feel that you're ineligible, we will give you referrals to FQHCs near you.
Thanks, Gabrielle. All right, that was a lot of good information, and we're happy for all of your engagement here with us. If you would like to keep your engagement with New Jersey Citizen Action going, we would be happy to hear from you about your Medicaid New Jersey FamilyCare experiences. So in our next poll, we are looking for people interested in sharing your experience as a story with us to help us in our future policy advocacy to make improvements to its services and the system. So those who select yes will have a member of the New Jersey Citizen Action team contact you. So let's start that poll. Great. We'll give you a few moments. Again, this is, we're looking for Medicaid or New Jersey FamilyCare experience stories, to help with our policy advocacy to make improvements to the system. So if you'd like to share your story with us, please make your selections. And I think we can close that poll now. Great. Thank you for that. And we'll now launch our final poll, which will tell us if you would like to be contacted in order to stay informed of New Jersey Citizen Action's upcoming outreach efforts. And we'll give that a few moments to and you just select your selection, and I think we can close that poll now too. Great. Wow, I don't know about you, Gabrielle, but this time has flown by. We've covered a lot here tonight. So everyone, remember the 1, 2, 3s of the redetermination process. Confirm your address, contact, and your contact information with New Jersey FamilyCare. You can call them at 800-701-0710. Check your mail for your eligibility packets. They will be in English and Spanish, and they will come from New Jersey FamilyCare. And remember to return them within 30 days. And if you are deemed ineligible, you can appeal the decision, or you can enroll in an affordable ACA marketplace plan through Get Covered. All of the registrants, again, and attendees will receive the link to tonight's recording and a copy of all the slides. I thank you again for joining us tonight. I thank you to the entire New Jersey Citizen Action team that worked to bring this event to you tonight. Gabrielle Escribano, Adam Tucker, Liz Glenn, Faryal Najib, Yvette Fernandez, Melanie Machuta Perella. And if New Jersey Citizen Action can be of assistance with any of our direct services, you can see them here on the screen listed. Please contact us. If you would like to be kept abreast of all of the New Jersey Citizen, all that New Jersey Citizen Action is working on, follow us on social media and click the link in the chat to be added to our mailing list. From all of us here at New Jersey Citizen Action and our co-sponsor organizations, we wish you a good night and be well.